the sacral ligaments. In some cases, dysfunction of the sacral ligaments could refer pain into the sacroiliac joint or also down into the sciatic nerve. If this area is hypersensitive, continue working on this until there's no sensitivity. This area could be sensitive because of falls as a child, epidural injections, or slouching too much. The sacral ligaments, we're just working on one side here, the left side, just working off of the midline. It's not very wide, maybe an inch or two in width. Just keep going deeper. Uncomfortable but never painful. As it starts to soften, you can go deeper. So where I find this region is just off of the center, and my fingers will go down to the coccyx where my finger falls off. The top of the sacrum is just below the posterior superior iliac spine, and you only go out maybe an inch or two just medial to the posterior superior iliac spine. Now remember, you have 3 layers to get through, so it's one layer at a time, and I'll cross fiber that for a few seconds and I ask the person, is it sensitive? If it is, then I back off a little bit. If it's not an issue, then I just keep going and work with the person, uncomfortable but not painful. Next is the ligaments that go over top of the sacrum. So we're working the right side of the body, and then you can also see the seam on their pants too. So I want to be just off of the right side of that seam. I want to be off of the midline. At no point do I go anywhere near the posterior superior iliac spine. It is way too sensitive. So I walk down, I find the tip of the coccyx where my finger falls off. Then the posterior superior iliac spine is here, so I need to be in between these points. And I'm just off of the midline on the right side. So from here, by using your fingertips, try and support your fingers if you can. Then I'm going to go straight down into the body when there's kind of a response. As far as the tissue, then I'm not going to push down anymore. And I'm just going to sink into it, and then I'm just going to cross fiber, very small little move east and west. So if you don't have the fingers for this, then just use your knuckles. That works pretty good too. So just on this right side. So as I start, I'm using probably about 3 to 4 pounds of pressure. Is that pressure okay?
Yeah.
Some people, this is a real dysfunctional sensitive area, so this could require you 10, 15 minutes to stay here. So you might really wear out your fingers at that point, because this could actually refer into the sciatic nerve. This could be the cause of it. So I'm just cross-fibering back and forth. As this releases, I'm going to use a little bit more pressure, and I'm going to keep going down. But remember, you want to be patient, not rude. You want to slowly get into that area. Is the pressure okay?
Yes.
The problem is, the more pressure I'm starting to use, if you look at my body, you can see my shoulders are starting to creep up to my ears. This tells you that you need better leverage. So now I can get up on my toes, and it's better, but it's still not there. So this tells me I need to get up on the table. Now take a look at where my shoulders are. See the difference? So let your shoulders tell you if you need better leverage. If your shoulders go up to your ears, then you need to get higher. So with this, I'm directly over top of my fingers, and there's like almost no strain in my body whatsoever now. And if I need more pressure, I just lean into with my body more. This is so much easier on me than doing it the other way. And the best way, of course, is to have a hydraulic high-low table. And then I don't have to get up this high. Pressure okay?
Yeah.
Is there any way you could describe to people what this feels like?
Very firm. It feels like knuckles. Is that what you're using? Fingers.
Fingers. Is it relaxing or is it uncomfortable?
It's uncomfortable, but not painful. Just
Okay, good.
very firm.
Every time that this releases a little bit, then I use a little bit more pressure. So I started with about 3 or 4 pounds. I'm up to about 10 pounds now. You can kind of see if you can see my fingertips, they're kind of turning white. So I'm using a lot more weight on here. Did you feel anything? Did you feel that release just now?
No.
No. So you're just off of the midline. At no point do you ever go anywhere near the posterior superior spine. It's way too sensitive. So after doing this for a good 60 seconds to 2 minutes with really good pressure, then you want to ask them, how sensitive was this? If it wasn't sensitive, then just go on. If it was sensitive and if it's uncomfortable, then there's a problem here. You need to continue. So how long do you continue until there's no more issue? So with her comment was that it was uncomfortable. So that means that you definitely needed to stay there a little longer on her and just keep doing that. And as I say, if you don't have the fingers for this, then use your knuckles or a tool or something. The iliolumbar ligament. This nasty ligament has to be one of the most painful sensitive ligaments we have in our body. It attaches from the transverse process of L5 to the iliac crest. If you remember what Dr. Ben Benjamin said about a structure that goes more laterally, that's main support for everything above it. So in a sense, this is literally what happens. It's one of the main supports for the spine. It's dysfunctional and sensitive on just about everybody because this ligament is under constant tension and strain. Remember, ligaments don't get very good blood supply. And we might move our lumbar vertebra, but very rarely do we ever move our L5 vertebra and S1 independently. They usually move together. So this ligament's very sensitive. It's also challenging to access. Just to get to this ligament, it's 1 inch down into the body. It's just medial to the posterior superior iliac spine. Because of the sensitivity of this ligament, it might require multiple appointments just to be able to reach it. I hope this animation will help you to appreciate the depth of this sensitive ligament. Next is the iliolumbar ligament. The iliolumbar ligament attaches at the transverse process of L5, and it's 1 inch down into the body just to get to it. So what I'm going to do with supported thumb position is go straight down, and by using her feedback, when she tells me that's enough, then I'm going to cross fiber north and south. And it's easy to find. You find the posterior superior spine, go touch medial, and touch superior. It's right there. So in order to do this correctly, though, you need to really get good leverage to protect your body. So if this is the posterior superior spine right here, then I'm going to go a touch medial, about 1 inch, and a touch superior, so about 1 inch that way. So it's an L. There, there. It's kind of a flat spot in the low back, so you're well above the hips. So in order to do this correctly, I need to have good leverage to protect myself. So I'm up on the table, supported thumb position, and I'm going to go straight down. So PSIS, go a little touch medial, a little touch superior, supported thumb position, and I'm working with them. So you need good feedback. When they tell you that's enough, then that's when you cross fiber it north and south for 5 seconds. Ready? So you tell me when that's enough. Just go straight down. Then you cross fiber north and south. 5 seconds. So I'm just using my body weight to do the work because there literally will be some people that won't say anything. And you have to keep going down to the basement to get there because it's 1 inch down into the body. So we got maybe ½ inch on her. So we didn't even get down all the way to that ligament. Wasn't that uncomfortable?
Yes.
So there's no point in overdoing it. If you want to go back, you can do it again, but this will actually help her a lot, even though we just got in a ½ inch and cross-fibering it for 5 seconds. People comment to me, Gary, they feel like that's the epicenter of my problem because all the pressure is right there in that ligament. The sacroiliac fascia. The positioning of this will be the exact same as it was when you were cross-fiber frictioning the sacral ligaments. But instead of cross-fiber frictioning, you're just going straight down through the different layers of fascia. There are approximately 10 layers to get through. Minimum of 2 to 5 to 10 minutes for this. I prefer to use my fingers because it's very specific pressure. If you don't have the finger strength for this, you could use the heel of your hand, your knuckles, your forearm, and you go straight down to the tissue barrier and then just wait. It could be uncomfortable but never painful. As it starts to soften, go deeper into that area. You can go same side of the body, cross the body, but just keep going straight down into the center of the pelvis. People comment to me, it feels like my leg is getting longer. Positioning on the same side that you were treating before, off the midline and medial to the posterior superior iliac spine. So I'm primarily going straight down, maybe just angling a little bit towards the outside of the hip. So it's 99% going straight down and maybe 1% going laterally. That'll help you to decompress the sacroiliac joint as well. And you focus on going straight down. I chose to show you this image of the latissimus dorsi with its attaching tendon as it goes into the spine as well as the sacral area. If you were to look at the sacral ligaments that we've already treated at its deepest layer, on top of that is the tendon of the attaching latissimus dorsi. On top of that is the thoracolumbar fascia. All three of these areas at the posterior sacral area, as it goes into the back, are all very similar tissue. They have a tensile strength of over 2,000 pounds per square inch. They don't stretch. They have a little bit of give to them. They don't have very much nerve innervation, and they don't get very good blood supply. So when they get injured, a lot of times they stay injured. So we have a dysfunctional sandwich of ligaments, tendons, and fascia. So this is one area of the body with all this different layers of dysfunctional tissue that requires a lot of attention. This is the sacral fascia, the fascia that covers the sacrum. So if this is the tip of the coccyx and here's the PSIS, then we want to work just off of the midline, exactly where we were before when we were doing the cross fiber stuff. But now we want to just be straight down into the fascia to release this, one layer at a time, minimum of 2 minutes. So you can either do it with your fingertips, you can do it with the heel of your hand, or you can do it with your elbow. But one thing's for certain, do not touch that posterior superior iliac spine. It's way too sensitive. I like to go on the other side of the body as well too, and with really good leverage. So if here's the PSIS, here's the coccyx, here's the midline. I'm going to be just lateral to the midline on the right side. And I'm going to go just straight down with my fingertips, using my body weight to do all the work for me. And if you don't have the fingers for this, then use the heel of your hand or use your elbow. So I'm going in really slow because I know this is kind of a sensitive area. Pressure okay?
Yep.
So it's about 3 pounds. You want to try and hold this for as long as you can. So you're patient, you're not rude. Don't go barging in. And you should start to feel this release within a few seconds. It just kind of comes like in waves. Are you feeling anything?
Well, no, it's not uncomfortable. It's pressure.
Are you feeling anything let go or relax?
There it is on the left.
Did you? You said what? Could you repeat that?
It felt on the left that it gave away a little. Mm-hmm.
What a coincidence. So I'm up to about, well, let me ask you, are you aware that I've tripled my pressure from when I started?
No. Feels like a lot less than when you were doing that last one.
Really? See how white my fingers are turning? Did you feel this? It just happened just now?
No.
Okay. It's all right. It's a unique feel, isn't it? Is there any way you could describe this to people, what this feels like?
Kind of like an elephant standing on my back. It's hard to not want to fight it.
Okay. Good job. Quadratus lumborum. I found a cadaver dissection video that helped me to realize the importance of the quadratus lumborum and also a very unique structure called the lateral raphe. So with quadratus lumborum, it's difficult to treat because it's underneath the erector muscles. So if you go from the center of the spine to the lateral side of the body, halfway between, that's the spot. It's just below the ribs and just above the iliac crest. It's a very small space. It's good to treat this in the lateral side lying position. It opens a space up a little, but you can still treat it in the prone position too. And it's very sensitive on some people. You have to go in slow and just let it soften. The quadratus lumborum. It's probably not the most effective. There are other ways to work this, but you can only get 2 fingers or maybe 1 thumb in there anyway. It's at the spot in between the ribs and the iliac crest. So if you walk down the ribs where you fall off, there it is. If you walk up from the iliac crest and you fall off, there it is. If you go from the center spine of the body, the middle, to the lateral side of the body, halfway between, there it is. So now all you have to do is just go 45 degrees into the center of the body and you got it. With some people that their back muscles are really thick, you might have to go a little more lateral and then just going in like that. Sensitive?
A little bit.
A little bit?
Yeah.
So just kind of hold that spot. Remember, we're knocking on the door. We're not barging in. We want to be patient and polite, not rude. And as that lets go, then we can sink in even a little bit more. Sensitive spot. And as you saw in that video, there's a lot of it to treat, but this is all we can get unless we have a scalpel. From here, you could go in a straight line up to the medial border of the scapula. That's the lateral raphe.